you're scared that somebody's going to come to me that I may say something about their diabetes, but this person over here that's telling you to use a crystal charged by the moon to stick up your rear end, you're not worried about them. We're not stepping on toes. We're not creeping in on
No.
physicians, nurse practitioners.
Like, wait, you're not going to massage me for 40 minutes? You're not going to do Easton? Where's my hot pack?
But you have to disassociate yourself from patients. Can't emotionally get super invested because you lose that objectivity.
What's up, guys? Welcome to the Physio Diaries podcast. We are your co-hosts, Dr. Melanie Ziaziris
and Dr. Alice Gojavatsky, where students, healthcare professionals, and wellness junkies come to get the inside scoop of the healthcare and wellness industry.
The podcast you didn't know you needed by your favorite travel physical therapist. Hi guys, welcome back to another episode of the Physio Diaries podcast. And today we have Matt Huey, physical therapist, physical therapy TikTok sensation. And thank you for joining us today, Matt.
Thank you
We have been following, yes, we have been following you for a while now, and we love your physical therapy humor and skits and things. They're so relatable and so funny and just so realistic at the same time. So today we wanted to sit down and get to know you a little bit more and pick your brain as a senior physical therapist. So let's get into it.
Gosh, it makes me feel a little old, but hearing the senior side of it.
But then you've also got TikTok sensation, so it's a little bit.
But I will say this: I said for the first 10 years of my career, I was going to consider myself a beginner. I said, once I hit the 10-year mark, then I could say intermediate. So
Okay.
that's what I said many years ago.
Yeah, I like that. I think that makes sense. So when did you become a physical therapist and how long have you been practicing for?
So I graduated in 2010. So 15 years now, just over 15 years. So you could probably say the senior, the veteran, you just start talking about it, you're like, oh my gosh.
Okay. And then 15 years ago, was it a master's or was it already a doctorate? Because I don't remember the exact timeline.
Yeah.
I don't have a doctorate yet. I'm working on it right now.
Oh,
but
okay.
always, have you seen Fired Up? Oh my gosh. It's so if anyone ever seen the movie, you probably get it. It's these two guys. They are they're football players and they want to date the cheerleader, so they go to cheerleading camp. And one of the girls that one of the guys likes is dating a guy who's in college, and he introduces himself as Dr. Rick. And they're like, "Doctor, aren't you a freshman? Aren't you pre-med?" He's like, "Well, I put off the inevitable." So my wife makes that joke about it. She's like, you just say, "Well, I put off the inevitable." And so,
So you're doing a transitional DPT right now?
yes. So
okay, cool.
When I graduated in 2010, my school was one of 9 left that were still masters.
Oh, wow.
And it was a big thing. So I graduated from Cal State Northridge. I am not from California, if y'all could tell by the funny accent. But they were going through that time of trying to switch over to the doctorate, and the schools were actually having an issue, the California state schools, because they weren't allowing them to have any doctorate. So every time they were saying like, "Hey, we're required to have this for the PT programs, we need to have this," they would say, "Let's put a teaching doctorate on there," and the schools would shut it down. I don't know the backstory, so please don't throw tomatoes at me on the story of anybody hearing this. But they were just shutting it down, and so it actually changed a lot of my program. You ended up doing 3 1 weeks, so you would either do 1 before spring break or after spring break. Then you did 2 during the summer that were 6 weeks, and your last one was your last one was 12 weeks. And so our class was the first one that they took away the 6th semester and made that an internship, because they're saying we're trying to get ready for this doctorate program. I was one of the few ones, and I still have it. And I've actually met somebody, one of my instructor's wives had a certificate of PT.
Wow.
She had been practicing that
Oh,
long. She had a
Wow.
certificate in
what is
physical
a
therapy.
That's
certificate of
wild.
So
PT?
it used to be that you went to like night school. And so
Oh,
Oh,
it was not a master's or a bachelor's. It was just like I want to say it's trade, but I don't believe that's correct.
yeah.
But
uh-huh.
it's like we train you that way and you get this
Yeah.
certificate to practice. And
Wow.
then
Oh,
she had been
wow.
practicing for gosh, since like the 60s or something like
Yeah, I was
that.
gonna say I have
Uh-huh.
even I know bachelor's, but I
Yeah.
didn't know there was anything before that.
Yeah. So she had that and she actually her story, she treated the first AIDS patients in LA.
Oh, wow. What an
Wow.
And he
interesting
would tell the
story.
stories of like they did not know about this
Yeah.
disease. He said had to fully
Yeah.
gown. They didn't know what to go on. And he said this the
Yeah,
fear. And he goes,
Mhm.
people were
for
like,
sure.
are y'all still sleeping in the same bed with each other? Like
Uh-huh.
just the fear that
Yeah.
people
Yeah.
had over this.
Yeah,
And so it was a
totally.
very interesting
Mhm.
learning
Yeah.
experience and seeing especially her
Yeah.
um over the years. And a cool thing too, we got to go to I think LA County Hospital. You know the
Uh-huh.
Hubbard tanks, the whirlpools.
Uh-huh.
Oh, yes. Yeah.
So they had one that it was the biggest tub I have ever seen. But it was like one, like you know when you lay down and do a snow angel,
Yeah.
it was that big.
For
You could
sure.
lay
Wow.
in it and put your arms and legs out. And they
Yeah.
said, yeah, we would fill this and range somebody. So you could fill the water and you could lean over the side and grab somebody's arm and range their arm or range their leg.
Wow.
And I mean, it
Huh.
took up like an entire room. It was huge.
Wow. That's so
What?
interesting. Yeah, I've never, like, seen that or anything.
Yeah. So then going back to you, you had gone through the master's program
Mhm,
and now you're in the process of getting your doctorate.
mhm.
So was that your decision or was that more
Yeah.
like your clinic's decision or like, hey, like you should do this?
It's more of mine. Just
Okay.
so I've thought about one day of teaching. Eventually, you know, I have that plan. I do
Yeah.
say we all have these plans that we want to do, but then life goes, haha, that's funny. But having the doctorate could just, you know, if I want to do something or what have you. So, it's just do it. Luckily, the program I'm going through, they recognize, hey, you're a working adult.
Mhm.
You know this stuff. Could convey that you know it.
Yeah.
How has it been then? Are you still working full time and then
Oh yeah.
getting your doctorate? Do you feel like you know most of the information that you're learning?
Yes, a lot of it. It's not like your ortho class or
Mhm.
Mhm.
therapeutic activity. It's nothing like that. One of them was
Okay.
pharmacology.
Yeah.
Now,
Mm.
I got a little introduction to pharmacology and radiology in school, but that
Okay.
was really insightful to see again because now when patients come in and they're like, "Well, why did the doctor give me this?" And
Yeah.
you can explain it a little bit better to them.
Yeah.
Yeah.
And you
Totally.
know, and if somebody's like, "Oh gosh, you know, I'm just kind of feeling like this," what are you taking? Um,
Mhm.
so
Mhm.
it was just very, you know, insightful for that.
Yeah.
Some of the
Mhm.
legality courses, so just this little stuff that has come out from that was just pretty interesting to sit and listen to
Mhm.
as well.
Give us some examples of what you mean by the legality stuff.
One thing was interesting. We were talking about like with HIPAA and showing, you know, people, you know, your patients.
Mhm.
And if you have your clinic and it's like, Joe finished therapy. Joe, you know, you finished. Would you mind taking a picture and that we can put it on our website and say, you know, Joe came to us
Mhm.
6 weeks ago with back
Mhm.
pain and now he's feeling great. And, you know, they sign the release and that, hey, we can share this information because you gave us written permission.
Yeah.
But say Joe comes back in a month and says, hey, I don't like that you're using my picture in your advertisements. People are asking me questions. Can you take it down? So you can say,
Mhm.
well, you gave us written permission and
Mhm.
this will hold up. Or did you
Mhm.
do the nice thing and say, you know what, Joe,
Yeah.
I'm going to respect your decision and remove that. So little things like that. Some stuff
Mhm.
about malpractice was pretty interesting.
Yeah, I feel like there's so much that we learn in school, like pharmacology, first of all. That was my like least favorite class
Hated
personally as a
pharmacology.
PT. It was so hard. I'm like, I
Uh-huh.
don't remember all these drugs. I'm gonna look them up if I don't know them.
Yeah.
And there's certain ones that like so many people are on that you kind of learn.
Yeah, for
But yeah,
sure.
also HIPAA, like there is so many like nuances to that. Like you said, like with specific situations, you have to be really careful.
Mhm.
And I feel like I'm always doing HIPAA training modules before every contract that I start. And I'm like,
Yeah,
Oh,
oh,
yeah.
okay,
definitely.
learn something new there.
Yes, and social media, that kinda goes what we were talking about earlier. I talked to
Yeah,
somebody else
totally.
about with social media.
hmm
There have been several instances of people posting something that they thought was funny, but you share people's information on it, so
Mhm.
you always have
hmm
to think like, "Okay, you gotta hide it." Or not
hmm
Yeah.
hide it, but not disclose it.
Yeah.
Yeah. Yeah.
So since you've been practicing for 15 years, what I guess changes then have you seen just throughout your career as physical therapist in terms of treatments, just being a PT, all of the different realms?
So, I really see us being more independent now. That has really, really been a big thing. When I started, there was, somebody had, "Oh, I've got my own clinic over here. I'm in this gym space over here." But it really seems like more, gosh, probably 8, 7, 8 years or so that
hmm
PTs have taken on like an independent provider. I'm not saying that we're stepping on toes whatsoever, because I
Mhm.
think that's really, if we ever talk
Yeah.
about the direct access thing or the whole thing with the primary care
Primary care.
certification, which is people are just
Mhm.
blowing it out of proportion.
Yeah, they
But
really are. It's crazy
if you want
this
to talk, so I was part, so
oh
I'm a
my gosh.
delegate here in Texas, so I was
Oh,
part of that
okay.
that helped.
Oh,
Oh,
Was
wait,
we
that's so
discussed that?
cool.
So we can talk
uh-huh.
about that in a second, but
Yeah.
Yeah.
it's that independent
Uh-huh.
of saying, "Oh, you have an issue? Come see me," and
Yeah.
feeling
uh-huh.
so confident in your
Mhm.
Uh-huh.
understanding. And I think this goes to that primary care thing. We're not
Mhm.
stepping on toes. We're not creeping in
Yeah.
on
No.
physicians, nurse practitioners. We're not creeping in. We are a contact point for a patient.
Yeah.
And if
Right.
stuff doesn't line up, hey, this doesn't seem right. I'm gonna pick up the phone. Hey, doctor, I got so and so sitting here right now. They have XYZ. They need to come see you.
Yeah.
And
Mhm.
that has been like probably the biggest thing I've seen. And even the public is recognizing us as an independent provider of saying,
Mhm.
why do I got to go see my primary care? You're the one who knows what to
Right.
do. People are seeing that to say, let me just skip those early steps and get right to you. And you can help
Yeah.
me.
The thing is too, it's like all of this takes time. For example, in PT school, I sprained my ankle. I had to go to a doctor, which took a week or two to just get in to see them. The appointment was
Yeah,
4 minutes
physician.
long. Yeah, a physician or someone that can refer me to physical therapy, like PA, but still, it took time. So then my ankle was not getting better.
Yeah.
And then I had to schedule for PT. So when I saw this physician, appointment was 4 to 5 minutes. She didn't even take my shoe off, didn't look at my ankle. She's like, "What do you want me to do?" And I told her, I'm like, "I just need a referral for physical
Yeah, just
Mhm.
therapy."
send me.
Yeah.
So in
And
those situations, it eliminates that like 2, 3 weeks where you just take time to just go see a physician or someone.
yeah.
Yeah.
And that's a big thing with that coming in is that people don't realize
Mhm.
what can change in that 2 or 3 week period. Say you sprained your ankle really bad. You went and saw your primary care or whatever, and then it could have been a couple weeks before you come in. You may have been super inactive. You could have developed a blood clot.
Mm.
They
Mhm.
didn't catch it because it wasn't there. Your PT
Yeah.
caught it because there was a change in that period of time.
Mhm.
Something
Mhm.
happens in this period of time. We have to be aware and we're screened for it. So it's not that that provider missed it. It developed in
Mhm.
that time to this time. I had a
Mhm.
physician once. Um, he was telling me that he had in the hospital, a patient passed away from the flu and they missed it.
Oh my gosh.
But the reason why is that they came in this super tight window where it did not present. They
Yeah.
had
Mm,
symptoms. We tested them for this stuff. They tested negative. He said if it had been later that evening, if it had been the next day, it would have showed up positive. She
Dang.
came in
mhm,
this super tight window. He goes, "It is
mhm.
so incredibly rare that that ever happens."
Yeah.
That's so
But
sad.
it's those little things going to the primary care. All it's really wanting us to do is just to recognize things. That
Yes.
that's it.
Like,
Hey,
no one's trying to
Mhm.
treat nobody's diabetes. Like,
no,
oh my
no,
No,
God.
or hypertension.
no,
Like,
no,
I posted a TikTok about it and it just like blew up and I got so many comments and people were like,
From
this is
doctors.
like from nurses,
Yeah.
physicians saying, this is terrifying. I'm like, if you even did a little bit of research, you would understand what this freaking means. Like, no one's
Mhm.
trying to manage nobody's hypertension,
no.
diabetes,
You can have
whatnot.
the
We're not trying to
diabetes.
prescribe medications. Like,
Yeah.
let's think about this a little bit more, maybe
Yeah, and
before
yeah,
Mhm.
assuming things.
I saw that in the comments. It's like
Crazy.
y'all did not even pause and take
Nope.
a
Mhm.
breath
Nope.
to go, what does this mean? Big
Yeah.
reaction. And yeah, and and I've talked about that. Just saying
Mhm.
like there's PTs that are like, oh, I don't want to do that.
Yeah.
You don't have to do it.
Yeah.
You don't access, and they put that you don't have to take direct if you don't want to. If you don't want to be a primary,
No.
you don't, nobody's making you do it.
Yeah.
Like I find that
Right.
unbelievable. If somebody said, "Hey, can you come see me? Do you have a doctor script?" No, you need to go see this doc. You don't
Yeah.
have to do it. You scroll TikTok for 5 minutes, you're going to get these whomever out there that,
Mhm.
oh, I can treat all of that stuff. It's like, wait a minute, wait a minute, wait a minute. You're scared that somebody's going to come to me and that I may say something about their diabetes, but this person over here that's telling you to use a crystal charged by the moon to stick up your rear end, you're not worried about them? Like,
Right.
Yeah.
Yeah.
okay, okay.
Yeah. Well, so we interviewed Kyle Covington, and this was like something that he talked about a lot. It's not like all PTs are going to be primary care specialists. They're still really early on and they're still developing. Like, is it going to be like a residency? What is that going to look like? What is the
Mhm.
training going to look like? It's not like we're all going to automatically be primary care PTs. We already have direct
No,
access in a lot of states. Like, primary care is going to be different, but it's still so early on. So the fact that people are already making assumptions is like wild because
Yeah.
like it's still being developed and it's still super
yeah,
early on and getting, put out there. So it was just so funny. For us, I just love like reading the comments because I'm just like people don't even know what they're talking about. Like
They
yeah.
literally know nothing. Like, they
Yeah,
absolutely know
it
nothing.
physicians. I'll tell this story. So,
mm,
I had a reaction to, the TB test.
Mhm.
Um,
mm.
oh gosh, show my age here. It used they call it like a puppy dog thing. I remember as a kid,
Oh,
they stab you, and it was like a little
oh.
like a
Like the
cluster, and
skin test.
yeah.
Oh.
And then now it's
Yeah.
just the little needle that they poke in you. Well, I had it done, and it was on the border. We can't really tell if it's positive or not. You need to go get a chest X-ray.
Oh.
I'm gonna tell you
Mhm.
what, how unbelievably hard it was to like go somewhere to be like, can you do a chest X-ray for me to be able to do the T? Which anyone out there, y'all understand, that's how you can
Mhm.
diagnose tuberculosis with a
Yeah.
chest X-ray. But to tell somebody I need to get an X-ray to determine on if I have TB. So you have
Mhm.
TB? No,
Yeah.
I have this. This test was questionable. Can I get the? So anyway,
Yeah.
went to just a primary care. I got the X-ray. We used to work next door to some orthopedic surgeons. I went to
Mhm.
one of them. I knew. I said, "Hey, could you read this X-ray and tell me what it says?" He goes, "Do you think I would know what TB looks like?" So think about that.
Yeah.
He is a surgeon. He is an orthopedic surgeon. He is a doctor.
Mhm.
Mhm.
A doctor, if we're going to go about that, all this, did not know, because what's his specialty?
Right.
orthopedics.
Orthopedics.
But
So
that's
it's like,
something you
look,
would have learned in med school, right?
oh, he went to med school so
Yeah,
long
I'm
ago.
Yeah.
sure it's so long ago.
Listen,
It's like
Yeah.
out of
that's
your
It's
brain,
like,
you know?
that's not
what I'm
my
saying.
thing.
That's his
Yeah.
specialty. Where he has
Yeah.
focused is in
Right.
orthopedics. So just to say, oh, okay, well, this orthopedic, is he going to diagnose and treat cancer? Can he
No.
treat
Right.
urology disorder? Can
Yeah.
he treat a neurologic
Mm-mm.
probably not.
No.
Yeah,
It's the
that's
same.
not the
It's
specialty.
yeah. So he's gonna go, um, you need to go see this person,
Yeah.
which is what
We
we
do.
can do.
Mhm.
Right.
100%.
Yeah.
Exactly.
Hey, this
Yeah.
doesn't make sense. I'm gonna, and what I will tell physicians as well, and I've started doing that with, so we have direct access here.
Mhm.
Patient comes in, hey, they've got a shoulder pain. I have evaluated them. Maybe we do 2 weeks of therapy. They're not getting better. You probably have a rotator cuff tear that we need to send you off, send you to an orthopedic. Guess what?
Mhm.
I could call you, said, hey, doc, I got a patient sitting here. I think they got a suspected rotator cuff tear. You have an appointment. They probably have an appointment. Now I have guaranteed a patient in your office that's going to probably need surgery because of what we did to send to them. Now
Mhm.
you've got a
Mhm.
guaranteed person in your office that you're going to probably get good outcomes from. And how much money did you spend on marketing?
Right.
Zero.
Right.
Mhm.
It's like,
Exactly.
do you want 5 people that come in that you're going to go, no, that ain't what I can see you for. Oh, this one didn't
Yeah.
show up. No, I
Yeah.
just made that easier for you.
Yeah.
Right. And I think we're pretty good at realizing, okay, this person needs surgery. They're not getting better. My old boss told me a story about how there were so many people against direct access for physical therapists when it was being brought up.
Of
And
course.
they did a big study. I haven't read it myself, but I'm going to take his word for it. But he said basically the big argument against direct access was that what if shoulder pain is actually a Pancoast tumor in the lung? And so they did a study and they basically looked and realized that physical therapists were able to
Yeah.
identify these Pancoast tumors more consistently
Accurately.
or
Yeah.
more accurately, yeah,
Mhm.
than the physician did because we see
Yes.
people more regularly. We see them
Huh?
longer. We can really screen and assess them and we can tell when something's not improving or not getting better. And then you're like, okay, something's not right here. Go back to your
Yeah.
doctor. So
Yeah.
that was amazing.
Yeah.
I've heard
So
about that study too.
yeah,
Mhm.
everything that we're taught, if we go back and look at school, is that if it doesn't make sense or there's these red flags, you refer. Every fail safe that we have in therapy is to send you
Mhm.
to the proper person that could
Yeah.
take care of you. Hey, you have a possible cardiac issue. You need to go see a cardiologist.
Mhm.
This is a neurologic. We're going to call. We can direct you to, rather than saying, "Good luck, have fun going
Mhm.
back into the system and get bounced around." We can direct you
Mhm.
to the right person.
Exactly.
Yeah.
Yeah.
Yeah. Okay. I want to switch
So,
gears a little bit.
yeah.
You went through the diploma program for the McKenzie method.
Yes.
Yes.
Mhm.
I feel like there's a lot of, I don't know, the McKenzie method is like a spicy topic, you know? Like there's a
Mhm.
lot of thoughts, a lot of opinions out there on the McKenzie method. So talk us through, I guess I didn't realize it was a diploma program or if there's
Mhm.
different like levels to it. So you could just talk more about that and then like why you chose to.
Yeah. So, the McKenzie method, or mechanical diagnosis and therapy. So Robin McKenzie was a therapist in New Zealand. He developed this in the 1950s, 60s or so. He tells a story that he said, we had this fancy machine called an ultrasound. And he goes, I never found it was very useful. And he
Mhm.
said, I had Mr. Smith come in. Mr. Smith had this bad back and leg pain. And he said, Mr. Smith, take your shirt off, go lay down on the table in this room. I will be in there. He's going to ultrasound his back. And he said, well, the patient before him was a knee pain patient. That he goes, I had ultrasound. So he left the head of the table up. He said, I walked
Mhm.
in. Mr. Smith is laying an extension. He said, we have been told you never extend somebody with back and leg, but you'll paralyze them.
Oh,
He walks in
interesting.
and he's like, oh gosh, but he's kind of nonchalant. He goes, Mr. Smith, how you feeling? He goes, my leg pain's gone. First time in 6 weeks, it's not hurting. He goes, oh,
Mhm.
well, how's your back pain? He goes, back's killing me. He goes, I'll live with this back pain. I couldn't live with that leg pain. He goes, oh,
Mhm.
very good. We'll come in tomorrow and we will do the same thing. And so they have a socialized medicine where you just come in. So he started playing with this methodology and use. And really, it's kind of two things. It's an assessment method. You're assessing
Mhm.
somebody to determine kind of a classification.
Mhm.
And I'd say, like, are you mechanical or not? Can I help you or not? And based upon what you find is that you maybe use repeated motions or sustained motions or whatnot to treat them to help
Mhm.
them get better. It kind of has that thing where people think like, oh, it's only press ups or retractions. That's
Mhm.
all you do. You just do those funny press push ups. That's all you do.
Mhm.
But it's you want to understand, and you may utilize a repeated movement or something like that, kind of like a medication. So you think, if
Mm.
I have the flu, I may take a medication to help the flu. If we happen to find a specific movement, a position, something that your symptoms start getting better, I want you to continue doing that. So as they get better, you're also getting them kind of empowered to go back to do their normal stuff as well.
Mhm.
And that
Mhm.
kind of gets lost. Like if you read some of his books, his autobiography, he was very big about a thing called play hardening. And that truly has been lost. So
Mm.
say you got somebody coming in with back pain and they start feeling good. They like to play golf. Hey, go play 3 holes of golf. Because what are they doing? They're bending, they're
Mhm.
swinging, they're walking, they're doing this stuff. So I played a game I like, and then how do you feel afterwards? How do you feel? I've just built some confidence with twisting and hey, I'm feeling better. That's perfect. You also
Mhm.
taught them, hey, if you start feeling your pain, you do X, Y, or Z that we did to help your pain. Okay. And like that's really kind of the point of it. Sometimes it's educating people, getting them comfortable to move and just feeling better. And it's a crazy
Mhm.
thing as well. People think like if they can't do a press up, you can't do anything. I didn't I don't forget how to be a PT. If somebody has
Yes.
chronic back pain, or is the press ups what they need? I don't know. Maybe they start
Mhm.
doing that, extending their back, and they're like, and they get confidence they can bend their back. But you know what else I'm going to
Mhm.
do? I'm going to have them start doing some pretty heavy lifting, some twisting, some pulling, and
Mhm.
you do the other things with them. People just seem to kind of forget about all of that
Yeah.
stuff with it. Um, so there are levels to it. So there are
Okay.
the classes. So you probably see them in the back of the PT in Motion journal, or you see them
Mhm.
online. So there's A, B, C, D, and E. Once you've taken all those, you can sit for the certification exam. So that involves
Mhm.
a written test and a practical where you sit down with somebody and you may
Mhm.
do the positions or you may do something. If you want to go beyond that, there is the diploma program. So that is
Oh.
Oh.
like 10 weeks of theoretical stuff. So
Oh.
it's not just like, oh, you're just learning how to do more press ups. It's like,
Mhm.
what do you do with somebody with more chronic pain? What are you going to do with
Mhm.
like pelvic pain? What are you going to do about more extremity pain? Right?
Yeah.
You're talking about these other tendon issues. What are you doing with them? What are you doing post-operative patients?
Mhm.
So
Mhm.
you really get into this other category. And then there is the residency component, which is 9 weeks you go spend working in a clinic. You
Mhm.
may get super complicated people, you may get super easy people in there, but you see
Mm.
Mhm.
anything and everything that comes in the door. And then you
Gotcha.
sit with a senior faculty member and you take a 2 day like practical exam.
Wow,
And
I
I
did
tell
not realize how
people,
much there was
yeah.
to it.
Yeah.
And I will tell you, the hardest patients to treat, you think, oh my gosh, somebody coming in with 9, 10 out of back, pain shooting all
Mhm.
the way down their foot. Those people are easy. It's
Mhm.
that person that's like, that kind of hurts a little bit my hip, like when I
Mhm.
sweep,
Mhm.
but
Mhm.
and it's like, what do you do? Because you just
Yeah.
you can't really like hammer them down sometimes while they are there. You
Mhm.
really have to work a whole lot with them.
Mhm.
Totally.
Some of our classmates worked in specific or in clinicals were at McKenzie specific clinics where they only did McKenzie for all parts of the body. Because I think of
Mhm,
McKenzie more for like neck and low back, but I know there's a bunch of different joints and things you could
Mhm.
do. Do you typically try it with most of your patients? And then what is the success, or does that kind of depend on the patient?
so here's the thing, what was it somebody said? Um, I tried that McKenzie thing, it didn't work. Guess who
Mhm.
the only person who could ever do a McKenzie evaluation or McKenzie treatment was Robin McKenzie. I do a Matt
Mhm.
treatment. You do a Melanie treatment. You do an Alice treatment and assessment.
Uh-huh.
That is what it is. So it's tailored
Yeah.
to however you are. So as you come
Yeah.
in, I am going to assess you mechanically because I
Mhm.
want to understand, are your symptoms mechanical or not? So if
Mhm.
we start moving you, what does that do to the symptoms? So does it make them better? Does it make it worse or no different? What does that tell me from there? If you're mechanical, cool, we can possibly treat that. If you're not mechanical, again, like what we talked about earlier, do I need to refer you over to somebody? Maybe you just got a
Mhm.
chronic pain or something like that. Okay, we just need to do other things. So that's really the big. Everybody's going to get a mechanical assessment
Mhm.
now as well. The second part of that, can I help you or not? And that can go two ways. You could be mechanical. Oh my gosh, you got back pain and we start doing
Mhm.
press ups and you get up and you feel better. But this person may say, no, 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 no. That's not what I want. I just want you to just do massage on me. Can I help
Mhm.
this person?
Mhm.
Maybe,
Right.
maybe not. Because
Mhm.
this person has maybe this is thinking what I need. I may not be able to want to help them, which I'm very happy to say, okay,
Mhm.
I can direct you to someone who can help you.
Mhm.
Now, looking at extremities, extremities are very interesting because I find, oh my gosh, this is probably going to be the moment that people are going to be in the comments, just like just typing away.
It's
But
okay.
It's
We
yeah,
get
good.
spicy
but
here.
good if you type it
Yeah.
all, just type, just be angry, just be fully angry. You need the engagement always helps. That's
Yeah,
Yes.
everybody
exactly.
just be angry. But to take somebody with an extremity symptoms and to really, really screen their spine to see does it change.
Mhm.
And all I tell patients, hey, we're just getting the spine out of the way. We're just taking that and
Mhm.
just scooting that out of the way. There was a study with frozen shoulder and about
Mhm.
who was better at treating frozen
Uh,
shoulder. Was it a physical
yeah.
therapist or a physical therapist assistant?
Oh,
And they found
interesting.
like the physical therapist assistant was better
Huh.
because they were
Mhm.
saying like they don't do like joint mobilizations. And so they were doing more exercise with
Yeah.
them.
Yeah.
Now, take somebody who's maybe has a lot of pain when they move and or
Mhm.
exercise with an extremity, they start moving and then it gets worse. That could possibly be of a spinal source. I tell them, let's move your spine around to see what
Mhm.
happens. If you come
Yeah.
back and you said, oh, it's better, cool. We figured it out.
Mhm.
But if not, okay, cool. Hey, we just got that thing out of the way. Rather than me sitting here and cranking on your arm and you calling me everything but
Mhm.
Christian, now we kind of have a better understanding of what to
Uh-huh.
do with you now. So
Yeah.
that's really just kind of how to look mechanically at it. And
Yeah. Mhm.
it also just kind of taught just really just how to systematically just like work with someone, just to really just kind
Right.
of move them, see what's going on. And patients, and patients enjoy it because they're like, wow, I'm doing like really, really good. I feel great.
Mhm.
So I was like, cool, there we go.
Yeah. Yeah. For people out there, like some people are think I'm crazy when I'm like, okay, so we're just gonna screen your back because this could be coming from your back, even though you feel it in your leg, or this could be coming from your neck, even though you feel it in your elbow right over here. And people look at me like I'm crazy. I'm like, just trust me. And then you screen it, and if it's clear, it's clear. And we just, made sure that everything's okay there. So I
Yeah.
like that approach, and I totally
Yeah.
agree.
And I do tell patients as well, like you just said, somebody go, it's my hip. It's my hip. You need to do stuff on my hip.
Mm-hmm.
I'm going to assess. And I'm like, okay, look, we have this stuff that shows it's possibly your hip. We have this
Mm-hmm.
stuff that shows it's possibly your spine. Now,
Mhm.
in my experience and what I does, this sometimes could be
Mm-hmm.
somebody with a spine issue. Maybe you got a
Mm-hmm.
secondary thing. Maybe that there's just something there. And guess what? You just got some free treatment on your back and you didn't have to pay anything for it. So, there you go. You got a 2-for-1 deal.
Mm-hmm.
But it like that's a way to say, like, hey, let's just you have some evidence for that there. I just want to
Mm-hmm.
be sure. And very often people are like, you're the expert. I am here at your hands, whatever that you do to help me.
Yeah.
Since you brought up massage, I was
Yes.
gonna bring up. You had posted about patients wanting Eastham and heat for chronic pain,
Mhm.
and you brought up the massage. So, are you using modalities? What modalities are you using? Why you created that post about the Eastham and heat
Yes.
specifically?
Oh, so the whole thing with now, I will say modalities feel good. They feel
Yeah,
good. What
yeah, they do.
no, it's nothing but you
Who
lay
doesn't
there
like
with
modalities?
Right? Who doesn't
the
like a massage?
tingly, yeah, the tingly thing on your back with some heat there. Or I played sports through college and throw some ice on something. You go, oh, you get it massaged or kind of work, rubbed. Those it feels good. So
Mhm.
I 100% understand why people like it because you're
Yeah,
hurting. Do something to make me feel better. There
Mhm.
are modalities that I am a fan of, and I will tell patients, hey, if you feel like sitting on some heat or some ice, it's just going to help you
yeah.
feel a little better to move.
Mhm.
Cool, but it's not going
Yep.
to change. I tell them it's not going
Mhm.
to change what's going on.
Yes.
Mhm.
TENS units. I am a fan of TENS units because
Yeah.
as I've had someone explain this to me, that say you've got somebody with a chronic pain, rather than them sitting there taking a pain medication every 6 hours,
Mhm.
you can use this to kind of control your pain for a little bit. And I've had some people that
Yeah.
done, hey, this modulates my pain, controls it a little bit more, just so I can, so it
Yeah.
weans me to the next time, or I get up. And I said, you can use these things as a way to,
Manage.
let's get the bigger thing going. And actually, in my clinic, I don't have any modalities, so I don't
Yeah,
Mhm.
even
we barely
have.
have
I mean, I got
any.
ice packs in there,
Yeah.
and there's a TENS unit, but I joke we use it to prop the door open. Like I,
Yeah.
I, I
Yep.
just, I just don't
That's funny.
address it. I
Yeah.
just don't go into it, so it just doesn't get brought up. Now,
Mhm.
somebody
Yeah.
may ask, should I do heat or ice, or should I do, and that's when I will explain,
Yeah.
like what I did, and
Mhm.
I could really see the struggle with. Just gonna kinda say in general, the big corporate PT, because
Mhm.
I've heard the story, I've had the talks. You gotta get that third, you gotta get that fourth unit, you can get that fifth unit, you just put them on there because you just put them on the heat and the stem, and you just set them over to the side, and you don't have to
Mhm.
supervise them, and that's $10 that you get, or you just get this, or you just get that.
Can't even bill
Mhm.
that anymore.
Oh, you can't?
I
Oh, I didn't
I
know.
have
You
never been
can.
able to bill for just straight heat or
Yeah,
just
oh,
straight
yeah, heat and
motion.
ice and all that's
Yeah.
gone. That's why
Yeah.
they're like,
Yeah.
do the vaso-pneumatic or do the
Oh,
Vaso,
TENS or
the
do
yeah.
the stem.
vaso-pneumatic, yeah.
Do the I
Yeah.
actually like vaso-pneumatic.
Yeah.
It helps
I
a
also
lot.
have varicose veins. I've had that treatment. That
Uh-huh.
works so
Oh,
well
interesting.
on me, with
Yeah.
the issues and stuff that I deal with. But it's like, yeah, I could see that you're doing that. I've also had issues when people use modalities. There's money in the modalities.
Mhm.
Mhm.
If
Totally.
I can do the feel good stuff with you, you just open a clinic that's just all modalities. Have Melanie's modalities. There we go. Um, and people will just keep coming in because it feels good.
Yeah. They love
But
it.
like, yeah, because it's like, oh, you know what? I go in there, I lay on that thing, and it stretches me out, and then I lay on this, and I do that, and people would just, they would just pay that money. But I
Yeah.
also see with a lot of stuff like Massage Envy, they'll offer all sorts of stuff. It's typically like people go like once a month. I go, every 6 months. There's not a lot of people that just keep going, especially with like chronic pain. It's like, do something now,
Mhm.
because
Mhm.
can you think about tomorrow, next week,
Mhm.
next year? It's when you've just been beaten down with this thing for so long, it's so hard to think about
Mhm.
the future. I
Yeah.
mean,
Yeah.
take people in like a very dire situation. I can
Mhm.
only focus on the now. I only have the now. What can I do right now to feel
Mhm.
better? And so that's all I can think about. So if I do some
Mhm.
heat right now, maybe it takes my pain from a 6 to a 3, and it's
Mhm.
just
Yeah.
10 minutes of
Perfect.
feeling good, and
Yeah.
that's it. And it gets very hard to just kind of break that. This kind of comes up so much online is I have this belief and I'm
Yeah.
going to just look at what confirms my belief. I'm going to tell you, hey, that's probably not going to be your best thing. Yeah, I can educate and I can go so far. If you don't
Yeah.
want to meet me, I did what I could. And I know that people are like, well, you could do more. Yes, you could do more,
We
but who
can't.
knows what more is? And it's just, it's
Yeah.
like you could do literally everything under the sun, and people say, well, you still could have did more. No, it's like, okay, you
Yeah.
got to cut your losses at a point. And
Yeah.
kind of going with that, that's somebody that we all see, maybe somebody in our
Mhm.
family that we see.
Mhm.
You just educate and you kind of stand by that. But I do believe overall, as time goes on, there's
Mhm.
going to be more change. As bad as this is, yeah, those people with that belief are going to be gone, and the
Mhm.
people with the do belief
Right.
Yeah.
replace them. And so eventually,
Yeah.
so
Totally.
it just you just ride it out. You help those
Yeah.
who can
Yeah.
help. There you go. And
Mm.
eventually it'll
Mhm.
change.
I actually had a really interesting conversation this week, and I was like, "Oh, perfect timing for the podcast. Like, how great, how
Mhm.
convenient." But I had a new patient, like a new eval come in, and the wife came with. They both were in the healthcare field, and she was actually a physical therapist, but
Mhm.
it's been like she's been retired for 5+ years, like not discrediting anything, but was in the bachelor's program and was a PT for a while. And, she was just asking me, like, oh, do you guys do heat, ice, like ultrasound, e-stim, all of these things? And I was like,
Mhm.
no, like, no, we really don't. Like, it's
It's
actually
changed a
like,
lot.
no, it's changed a lot. Like, ultrasound is actually like, there's like for Achilles, there's level A evidence to not do it. Like, there's so much evidence against it because it really doesn't do much for a lot of things. And now we have other things like dry needling, and like exercise is just so much more effective. And
Mhm.
it was just so interesting to meet a PT with, like, just in that realm of, like, generations of PTs, and, like, talk about
Mhm.
it with them. And I was like, wow, like, I haven't experienced this yet in my career, from, like, an actual PT, like, I've had patients come in and be like, oh, I got PT like 10 years ago and did like ice and tens and maybe a couple
Mhm.
exercises. And it's like, it's so different
Yeah.
now, and
Mhm.
so many
That's
things
the
have
thing.
changed.
I think that a lot of PTs get kind of, and I find myself kind of doing similar treatments, and you almost get like stuck in your ways. You find the way that you like to treat. I've also had so many people come in and be like, wait, you're not going to massage me for 40 minutes. You're not
Yeah.
going to do e-stim. Where's my hot pack? Like,
Yeah.
I've been at clinics where as a tech, I worked at a clinic where everybody gets a hot pack, everybody gets an ice pack, some kind of modality. Like, I worked as a PT in a clinic where everybody gets offered vaso, and you really have to, you
Oh,
learn how
wow.
to push vaso. Like, oh, it's this compressive device that's going to feel really good. Like, obviously everyone's going to
Mm.
say yeah if they have time.
Yeah.
That's why these beliefs come from, or where these beliefs come from, and it's so much education. And I feel like sometimes like a broken record saying these things, but it's really hard to retrain someone to be like, no, we also do exercise here. Like, it's not just passive stuff, because obviously the passive
Mhm.
stuff is easy on your part and feels good, but we have to pair that with the harder stuff like exercise.
Yeah. I had somebody several years ago, a therapist that, oh gosh, they were pushing an MLM on me. That is another thing that irritates. Just something, and I'm just like, okay, whatever. I was talking about something about, like PT clinics or gyms now. Like
Yeah.
we have there's
Hmm.
squat racks and this. And they're like, oh,
Mhm.
Yeah.
well, what do you do with someone who
Yeah.
just a rotator cuff a week out? It's like,
Yeah.
what's the difference? They're not on those machines.
Yeah.
You don't come
Yeah.
in. It's like you don't do that. It's what's the difference in an office setting or a hospital or your house? What's
Hmm.
the difference? You're going to treat them
Yeah.
based upon it. I actually had done that. I was not in a very good mood one time with a patient, and they walked in this clinic, and we had, I mean, this all the machines. "Oh, well, I can't do all that." And I was just like, we're not going to do that one or 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 that
Hmm.
one or that one. I was young, me. Don't, the
Uh-huh.
people say, don't hold it against me. That kind of comes up with a patient at times. It's like, Why do you believe that? It forms a discussion and a talk, and I will this is probably segue into something else, but,
Uh-huh.
if y'all ever meet me, I'm a really big guy. I'm 6'2", like 230. I am really
Oh,
big
wow.
and imposing and scary
Uh-huh.
looking to people,
Uh-huh.
and I can't tell you the number of times I've walked into the waiting room and the fear somebody looks at me
Yeah.
of, "Oh
You're
my
like, "This
gosh,
guy's
what,"
gonna make me bench, like,
Yeah,
250 pounds."
you're gonna hurt me. You're gonna do all this to me."
Uh-huh.
And and I've I remember it was a lady says like, "Are you gonna hurt me?" I said, "Who told you that?"
You're like,
Well,
"That's
my
my
husband said
job as
that."
a physical
Well
therapist." Just kidding.
I said, "Well, who told you that?" And she said, "Well, my husband." "Has your husband worked with me?" Well, no." "Well, how does he know that?"
Mm.
"Well, he doesn't." "Well, have you worked with me to know that?" "Well,
Yeah.
no, I haven't." "So you passed a judgment on me
Yeah.
and this is what's going on without knowing it." And you get to see it's like,
Right.
"Oh." And then they got done with the session, they were like, "That didn't hurt at all." Well, there we go.
Yeah.
Yeah. And to kind of your point too, I had this kind of leading the things. I work for a company, and I don't know, we can put this out there. The 10 commandments of physical therapy, you could find them online. There, it's a joke.
Okay.
It's an old
Uh-huh.
joke. It's probably needs to be go away. And I worked in one clinic I was running in. It was on a piece of paper, and I thought it was a joke, and I left it. It was just kind of sitting in the front.
Yeah.
Nobody really ever saw it. Well, this company decided to send to all the clinics a poster with it on there. And they put it in the, and I was running, I had picked up a second clinic to run, and it was on that front. And one patient said one day, "I'm not getting any better." And they said it to the receptionist. And they're like, "Why didn't you tell us?" "Well, that number 4 right there said, 'Don't complain because we won't listen.'" I walked right up front, pulled it off, and threw it away. In
Yeah.
that
Wow.
moment right there. And I'm gonna tell you, somebody with the company, they're like, "Why didn't you put that poster up?" And I told them, so, well, they put it, I went, they tell me, "Oh, we put all this research." "Let me show you this picture that's already 10 years old." And I said, "You
Yeah.
want a person coming in here and having a negative thought based on that?
Mhm.
That is
Yeah.
not what we do believe." And I said, "Fight me on it." And
Mhm.
they gave in.
Yeah. I
That's
wanna look it
funny.
up now, and potentially we can go through it, Mel, and do an episode about it.
Yeah.
Yeah, yeah,
Yeah.
that'd be very good.
Yeah, I've never heard of that, but I'm sure it would, like, give us a kick for sure. So Matt, we wanna switch gears a little, and, this is, like, a more serious topic that is unfortunately pretty common in our career and in healthcare careers is burnout. So I personally have worked at like 8 different clinics now, and you don't
Yeah.
see therapists being in the career 20, 30 years.
Yeah.
Why do you think that is? And what do you think helps you kind of avoid burnout, I guess?
So that is the thing. And I know I went through that probably 6, 7 years into my career. Went through, I'm just really
Mhm.
burnt out. And I'll tell you,
Mhm.
unfortunately, in healthcare, you're everybody wants help. Everybody's like, help me do
Yeah.
this. And our jobs are never done. They're just,
Mhm.
they're not. And it can be taken advantage of, hey, companies can do that. "Oh, well, you need to stay later to help. You need to see more people." You can do those, that it gets very easy to get in there. A big
Mhm.
thing that I started doing is having to say no, and just to be like, "I can't. I am one person. If I can't take care of myself, if I can't put the oxygen mask on myself, I can't help anyone else."
Mhm.
Mhm.
And so that was kind of a thing, is to say, "Let me put these boundaries there." But it's like,
Mhm.
these are the appointments that we have. Okay,
Right.
there we go.
Yeah.
Like, if someone that wants to explain to me, like, you go to your dentist, you can't tell your dentist, "I'm coming at 10:30," and they're going to be doing
Right.
Mhm.
two people's teeth at
Mhm.
one. They're not. They're
Yeah.
going to be like, "We have an
No.
appointment at 11 o'clock on November 7th." Like that's what we have. So just
Yeah.
setting those boundaries to say, "Okay, this is what it is," and
Mhm.
sticking with them. And of course, and I will say that the work is never done. And when I go into work, I always will say, everybody's going to come in, everyone's going to get treated. Like, that's
Yeah.
what it is. Everyone's going to come in, everyone's going to get treated. Tomorrow, the thing, it'll start over tomorrow. So that's kind of how I look at it. I also find a lot of joy in figuring out what's going on with people. I find
Yeah.
like that is it's fun to do that, and that's what a lot of like the McKenzie training. What is going on with you? And people are like, "Do you ever get bored?"
Mhm.
But it's like, no, because everyone's actually a little different.
Yeah,
It
for
does get
sure.
boring if it's like I've had like 6 knee replacements in a row.
Yeah.
Like
Yeah.
it's like now I will say if you hit a slump where you're just like everything is bad, nobody's getting better. Throw a knee replacement in here.
Yeah.
Woo, that
Yeah.
gets me
Yeah.
right back on track.
True.
I am the I can rule, I can do anything now because they're
Yeah.
just straightforward. But it's doing those things. I tell people early in their career, really see what you like and what you don't like.
Mhm.
And you don't want to focus on what you don't like because if you focus on what you don't like, you're going to get more of what you don't like because that's all you're focused on. I don't like working like neurologic or like vestibular patients,
Okay.
and but that's
Mhm.
just because it just didn't work with me. It just
Yeah.
Yeah.
so I was like, no, I'm going
It
to
is
kind of
very
go,
different.
yeah. So it's like, don't make me do something that I don't feel confident that you're not going to get the
Yeah.
best results. I'm just going to
Right.
do
Mhm.
with that. On your boundaries of just, with an
Mhm.
employer or one, I just don't know. I'm not doing that.
Yeah.
No, I'm not
Yeah.
doing that. And if they let you go, you can find something else. I would say
The
a
good
great
thing
thing about
is
physical
PTs are
care.
always
Yeah.
in demand.
Yeah.
Endless
Everyone's getting
job
older. Everyone's getting hurt.
opportunities. Yeah.
So,
Yeah.
so that's what I look at. Like, and if you want to start, treating people on the side, doing your own thing, there are people that do search you out to say, "Hey,
Yeah.
Mhm.
you're a physical therapist. That's what I need." And
Yeah.
you can do those things. Taking time to go enjoy stuff and leave work at work. I
Mhm.
just think a lot of the stuff is helping with like the AI tools with documentation.
Yeah,
I'm
true.
saying that is really helping because that's usually been
Mhm.
the biggest thing.
Definitely.
That it's like, hey, this is coming forward and like that this is making it
Yeah.
easier. I will say try to work your way up. Sometimes people are like, "Oh, let me work up, 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 up," and you just end up working all the time. If you just like treating patients, you can just treat patients. You just do
Yeah.
that.
Right.
Just and do the things that you enjoy and spend the time with friends and stuff like that. And just
Mhm.
that's about the biggest thing I would say.
Yeah.
Every day's new.
I
Every day's different.
Yeah, I was gonna say the boundaries are huge, especially for all of our new grad practitioners out there. You initially, when you first start, you're so excited and you're eager, and sometimes companies can take advantage of that. And they'll ask, "Oh, can you squeeze this person in during your lunch?" Once you say yes, they're kind of gonna ask you every single time and almost expect that from you. It's
Absolutely
hard,
not.
but you have to set boundaries early on. I try my best. Once my last patient is out the door, I finish my note really quick and I'm done. I never stay later. I document a little bit, like during lunch if I have to, but I try not to stay later than I need to. If my last patient is at 5:30, they finish at 5:30, I'm out of there at 5:35. Because there's therapists that I know, like new grads or a year or two in, that stay like an hour after to document. And I'm like, you can finish that for tomorrow. It doesn't need to be done today. Hopefully, you'll have a cancel. You should not be working when you're not being paid. That's my
Yeah.
thing.
Mhm.
Like,
Yeah,
set those boundaries.
and this is going to be hard to say, and it could be very easily taken out of context. But you
Mhm.
have to disassociate yourself from patients.
Yes.
Yeah.
I care for everybody I see. I care deeply. I want you to do the best, but I can't emotionally get super, super invested
Mhm.
because
Yeah.
you lose that objectivity. And,
Definitely.
Mhm.
that could very easily say like, Matt, you're heartless. But
Yeah.
you have to be that firm. I've got to do this. I got it because if I don't, and if I start bending and bending
Mhm.
and bending, you're not going to be you're not going to get the benefit. You're
Yeah.
not going to get the help because, and I will
Yeah.
say, and I'll put this out to anyone, look at a family member or a friend or a patient, whomever, that someone close to them gives into them on enables everything they do. Like
Mhm.
people will just take advantage of that. And
Yeah.
even with patients, and I've said this, I think this is a big thing in healthcare,
Mhm.
that it is we are accountable on our side and you need to be accountable on your side. You can't be upset that I'm not going to stay 45 minutes afterwards because you were 30 minutes late to your appointment.
Mhm.
And
Mhm.
now, granted, I understand something happened. Your car broke
Mhm.
down, work was up. Hey, hey, stuff happens. I'm going to work with you on that. Look, you need to be accountable. You have to help yourself, to this. I'm going to help you. I'm going to be part of it. It has to be a joint effort. And it's very easy that people can just play that. Well, just give me,
Yeah.
family members and friends, they're going to want to keep pulling from you as well. And I'll tell you, in any kind of service profession,
Mhm.
everybody will come to you for help. You know, I have a buddy who's a mechanic, and he had somebody come to him one time and said, hey, man, would you help me put together this car? He goes, is it going to be my car? He goes, no. He goes, you going to pay me for it? No. He goes, well, I ain't going to help you. He goes, well, you like working on cars? He goes, I work on
So
my own car. He goes, if you
Right.
ain't paying me or it ain't mine, I ain't doing it.
it's your
No,
time,
absolutely not.
yeah.
Yeah. And I would say that with anybody. It's like, okay, so you want this, you know, you either, compensate me for it, or you should come work for me for free as well. So to draw those
Yeah.
boundaries, like, I'm very willing to help, but you
Mhm.
gotta you gotta invest in this as well.
Totally. So, big question here. If you were to do it all over again, let's say you're 20 years old right now, would you still choose to become a physical therapist?
I see. I
It's
think
a
I
hard
would.
question.
I
Because
would
we
say
talk about this in the clinic all the time.
Yes.
because I know there's the thing that it said, like, well, I would have done this, but you don't know
Yeah.
Mhm.
what life or what not would have been outside of that.
Yeah.
When I
Mhm.
look back on it and everything that I see and I do, I feel like, man, I've had a lot of fun with all this. I'll do it again. Probably make a few different decisions along the way,
Yeah.
but no, I'm like, this is fun. This is fun
Yeah.
for me,
Yeah.
you know. So
Yeah.
I just said, I enjoy it. I look at the future and the positive aspects of it. But like I
Mhm.
said, if I want to up and move across the country, I can do that.
Yeah.
There is the freedom and flexibility and the other stuff that we do, that it's
Mhm.
Yeah.
like, yeah, we
Yeah.
could do that. It'd be fun.
It's
For
always
sure.
so refreshing to see a therapist that's just like, I don't know, not burned out. Like, you love your job. So my boyfriend's also a travel PT, and we talk about this a lot. Like, on the days that they are tough and like you do feel exhausted, we at the same time like kind of have to put it into perspective. We're like, we literally get to just hang out with people all day. We get to move. We don't have to sit at a desk in a
Yeah.
cubicle. We literally just get to talk to people and, have them exercise. And at the end of the day, it's just such a great job and we are grateful for it. But we do acknowledge that there are tough days. Like there's no job that's going to be 100% perfect or 100% easy.
Yeah.
But for me, it's so nice to talk to someone that like loves their career.
And
Yeah.
if you start seeing patients, and the more, and I've said this, one of my first jobs was in a clinic that was like 90% workers' compensation.
Mm.
Um, and I'd say this: I have never met the person with the world's second hardest job. Everybody has the hardest job in the world. People will
Yeah.
explain their job in the most complex. I had a cake decorator. I am not talking about the like
Uh-huh.
cake boss. I'm talking about someone who works at a grocery store with the sheet cakes of you put on the icing, and like explaining that job in the most complicated, difficult ways. The majority of people will don't like what they do. And I can also
Uh-huh.
tell you, seeing the same patients over the years that were like, well, if I go work over here, I can make 27.58 an hour and I can do all this and I
Mhm.
get all that. Then they get over there and they come back and see you. Oh, this place is just terrible.
Mhm.
You were singing the praises last year. You don't remember
Yeah.
that? You don't remember the positives about that? So it's like, you you just do what you can. They always
Yeah.
say the
Yeah.
grass is always because it's fertilized with different BS. That's all it is.
Uh,
So
For sure.
you
yeah.
can make a decision to be negative, and I honestly believe when it comes to PT, the people that are negative just want to be negative. And I will say
Yeah.
Mhm.
that, and I'll comment and say, there, you could literally give, this is my soapbox I'm on. You could give them everything that they want and they would still find something to complain about.
Yeah, I agree
Yeah.
So
with
I'm
that.
like, you know what? You can go be negative Nancy over there, have your pity party. You're not going to bring me
Yeah.
down. I'm going to go have fun. I'm going to do this. You can go be
Yeah.
negative over there, have fun.
Just don't let
Bye.
it get to you. Yeah. I'm
That's
definitely
it.
gonna start using that "the grass is greener on the other side" quote. I love that.
So I'm from the South, where a lot of my
Mhm.
friends, family, people I've seen have worked trade jobs.
Yeah.
They are in their 40s. They are destroyed. Their bodies are so beat up. They are so
Yeah.
Yeah.
tired. They are worn out. They're like, "I wish I had done anything else but this." And they know I have to get up at the butt crack of dawn and do it all over again. And it's like,
Yeah.
okay, again, you're looking at the positives of it. You don't see
Mhm.
the other side of it, which they look at what I do. Oh my gosh, you get to work in the air conditioning all day? Oh, and you'll
Yeah.
get like insurance and you just get to do, oh, I wish I could
Yeah.
do this. That's how it
Yeah.
is.
So I want to segue into the last question because this is how we found you was on social media. I thought your videos were so funny. I was like actually dying laughing at some of them because they're just, yeah, they're very accurate. What made you want to post on social media?
So I've always had a bit of sense of humor. I was never the class clown. I was actually the quiet one, which is so funny than getting
Oh.
into a
Oh,
profession that you
Yeah.
have to talk. You have
24/7.
to conversate with people. But I grew up watching like old Saturday Night Live, and I found humor in what they did and liking funny movies and just laughing and just doing that. Several years ago, with Instagram, I was like, well, let me try to do this thing. And then really recognizing I don't have the skill set to post like, oh, here's like three great shoulder exercises, or oh, like I don't have that ability to do that because it does require a lot of time and effort. But I'm like, you know what? I can be goofy. I can be
Mhm.
silly. And I've always kind of done that in the clinic, tried to make things light with patients, make
Mhm.
crack a joke, everything, you're in a dark spot when you come in
Yeah.
there sometimes. If I can make
Mhm.
it a little bit brighter, I'm listening to you. But if you make it an enjoyable experience, it's just going to be better.
Totally.
So
Yeah.
I was like, well, let me just try doing this. And it just kind of just started steamrolling, and then I went, okay, well, let me try to make these videos to take a situation that we deal with and
Mhm.
kind of put a funny spin to it. And that's been
Yeah.
interesting in a couple ways. One is that so many people see the same thing. It doesn't
Mhm.
matter if you're here or on the other side of the world. People are like, I had that patient in my clinic yesterday.
Yeah.
It's
And
a
it shows that
universal experience.
we're all the same.
Yeah.
We're all the same. But also, kind of going to those negative Nancy's over there, that people will look at this 5-second clip and make a decision to go, "Oh my gosh, you do this." It's like, you know what? You didn't see this part. You didn't see this part. You're judging off of this. Do you honestly
Mhm.
think that I took this situation and did not do the right thing? No, I took a
Mhm.
situation, kind of blew it up, made it a little bit funnier. You look
Right.
at it, ah, that's cute, and then you go on. Okay,
Yeah.
but it's very fun and enjoyable, and
Yeah.
it's like it's entertaining.
Yeah,
Yeah.
keep doing it. We love them. We love to see them. All right. Well, we love chatting with you today. Thank you so much, Matt, for joining us today and discussing the profession more with us, being a little bit more experienced in the field. Where can everybody find you on social media?
So on Instagram, you can find me at this long handle. It is Matt
Mhm.
underscore PT underscore DIP underscore MDT. Um, Now I will
Perfect.
say the reason that I keep that is that a good friend of mine who got me into the learning about McKenzie um, lost a battle with mental health, and I keep that for him.
Oh,
So I always remember him.
Yeah.
Um,
yeah.
on TikTok and YouTube, you can find me at Matt underscore the PT.
Mhm.
Nice. Well,
Okay. Yeah, we will also link that below in the episode notes. So definitely go find his TikTok and Instagram, because if you're in healthcare, you will get a laugh out of these videos.
Yes. So relatable. So funny.
Yes. Thank you guys for watching and listening. Don't forget to rate our podcast so we can get more guests on like Matt. See you guys next week. Bye.
Bye.